Welcome, everyone. Thank you for joining us. My name is Bianca. I'm with the Men Engage Global Secretariat. And I'm just going to start with a little bit around housekeeping, and then I'm going to hand straight over to Wessel, who will lead us through the session. So we're in, as you can see, the Politics of Care session 4. This is the last in the series, and it's about when men receive care.
Thanks so much, Bianca, and welcome everybody. It's really interesting. Bianca shared with us that we've got 133 people registered, which is really interesting that we've got only 10 of us here. But it's lovely to have you, and this will go onto YouTube. So I think also welcome to those who are watching this after the fact. This is the fourth session in a series of seminars, actually, or webinars, that follow different phases of an ethic of care. And we've got a group of panelists who have come the whole journey with us. So I really welcome everybody, and it's lovely to be on this conversation with everyone. Let me start by asking my colleagues to introduce themselves, and I think we can just follow the sequence of the icons on the screen. So let me start with myself first. I'm Wessel van den Berg from Sonke Gender Justice, and I am currently the Research Monitoring, Evaluation and Learning Manager at Sonke Gender Justice. Over to you, Asanda.
Hi, I'm Asanda Ngoasheng. I'm a gender activist, and I also work with Oxfam South Africa. Thank you.
Hello, everyone. I'm Tomas, Agnemo from Sweden. Actually, I'm on parental leave now with my son, who is 16 months. So I do work at Plan, but I haven't been there since December and joining them again in August. So I'm more here as a father of 3 than my professional role, I would say. Thank you.
Hi, everybody. I'm Taveeshi Gupta. I'm a research fellow with Promundo. Happy to be here and excited to have this conversation.
Thanks, everyone. And I think Rukia has not joined us yet, but she will join us. I had sent out a different time than this time to colleagues, so I appreciate everybody's flexibility, but I know that Rukia was also supporting her daughters to be able to attend sport. So she was saying that she's going to join from her car, but I think Rukia will join us shortly. Rukia is the lead on women's economic justice at Oxfam in South Africa, and a colleague to Asanda. So here's the overview of the conversation. It follows a similar format to what we've had before, which is just to revisit the conversation about an ethic of care and what we mean by an ethic of care. Then we're going to zoom into the topic of this session, which is to talk about men receiving care. And then the third aspect is to talk about the structural and the policy implications of men receiving care. I will provide some input from some literature that's been published on the topic, and also I'm currently busy with my doctoral study on exactly this, so I'm also drawing on some of the work I've done in that regard. But as we've done with the previous 3, it's really valuable to be able to have the colleagues and the friends from around the world who share this conversation. I think as we've heard in a few of the Men Engage Ubuntu Symposium sessions, this conversation is one of those where we want to enliven the narratives that come from the decades of feminist and pro-feminist work that has happened within the Men Engage Alliance. I think, my journey might be similar to many others who work in the field of engaging men for gender justice, which is starting from the point of working with men for gender equality, and not really starting from a women's rights perspective or from a feminist perspective, and then expanding to including men as a part of that. And I really have to say that the last few years has for me been a process of actually starting to understand the width and the depth and the the wide field of feminist work on which this work has depended. So I think within the Men Engage Alliance, it's really necessary for us to have conversations about the feminist theories that inform what we do, and that have preceded or accompany or have exceeded what we've attempted to do in this field of engaging men. So this series is an attempt towards that, to have conversations about especially the feminist approach to an ethic of care. So just in the context of talking about revisiting the conversation of an ethic of care, if we jump into that, I'm drawing significantly on the work of Joan Tronto. This book was published in 1993, so many years ago, but it was and is, I think it remains, a very influential conceptual and theoretical contribution to care ethics. It followed on the work that had been published earlier in the late 70s, or actually 1982, 1977, 1982, depending on which edition, by the psychologist Carol Gilligan, who I think many people credit her, along with Joan Tronto and Nell Noddings, as being the main contributors to conversations about what it means when we talk about an ethic of care. Just a quick review. We've mentioned this in the previous seminars as well, but Gilligan's work really pointed out the difference in conceptualizing moral development. So what do we think about as good or bad? And the fact that much of the psychological theories at the time were very male-centered. So it was written by men who were studying men about men, and this was purported to represent all of humanity. So Gilligan very much challenged that by adding empirical data from studies that looked at women and girls' responses to the same moral questions that were put to boys and men, and her case being that the responses were as valid and presented a different set of responses. Tronto's interpretation of Gilligan was very much that Carol Gilligan was correct, but she did not say that these were inherently female responses. It's often misinterpreted like that Carol Gilligan had said that women always respond like this, which is not what she had said. She had just said that, these were the answers I received. So Tronto then went into this deep association that we see in society between women and care, and the marginalization of care. And I think a more recent publication is the Care Manifesto, and in line with Oxfam's global paper Feminist Futures, and some of the other recent reports that organizations like Oxfam or CREA or the COFEM group have put out, we have, I think, maybe not a revival, but there's also, I think, in the context of COVID, people are again very sensitive to the importance of gender justice and how it relates to care. So just before I get to a question to the panel, just to briefly mention, this is a very reductionist summary of what Tronto had put forward in her book, but I think it applies today, where we see how there were three separations that had happened. The first one is a separation between morality and the public life. Whereas earlier in earlier societies, European and African, Global South and Global North, morality was very much regulated by a small settlement of traditional leaders, lots of interaction at a small scale phase. As markets developed and as distance between people, and actually Tronto refers to social distance, which I think we've all become very familiar with, but as distance between people increased, this need arose for regulating, agreements and values across great distances. So how do you agree with somebody in another continent about what is good and what is fair? So we saw a separation between morality and the public life, whereas morality became increasingly kind of romanticized or feminized and made a kind of a sentimental, and separated from the public life. And that was the first separation. The second one is this separation between the personal and the political, or the private and the political, where private life was again feminized and separated from political life. And the third separation is between quite a conceptual, abstract, reason-based sense of morality. So the whole thing about Immanuel Kant, and that being a very clear basis of what justice should be about, is this kind of intellectual reasoning. So the good is achieved through reasoning and logic. And that became separated from particular contextual lived experiences. So what happened with these three separations is that the public, abstract, and the political life and profit-centered became the center of value in society. And care as a practice, so not only as an idea, but as a practice of actually doing care work, became marginalized by these boundaries. And what that has led to is that we attach more power to the public, abstract, political, male-centered manifestations, and less power to care as a practice. And I think, for those, this group on the call is quite small, but I think for those, in our work, we're quite familiar with this dynamic. I think what Tronto's contribution was, which was really, really, I think, a useful framing. And I think if we consider engaging men in care, we need to be sensitive to this. What Tronto contributed was identifying that different types of care fall along a different levels of power or amount of power associated. So she was distinguished between caring about something or somebody, taking care of something or somebody, giving care to something or somebody, and receiving care. And the caring about is very much the paying attention to something and noticing that care is necessary. So, for example, the familiar example of men not really knowing what the shopping list should be, or or noticing a child's need that a mother would notice. So being engaged in the mental work of caregiving and not being ignorant of the work that needs to happen. That's what caring about is about. And we dedicated the first session in this series to that conversation. The second one is this one where you actually start to take responsibility for the other. So you take care of a person or something. And we spoke a lot about taking care of the planet, the natural environment around us, and of people. And I think, this is a parallel conversation to the series that's also happening in the symposium on men and the climate crisis. And if we're talking about climate care and climate justice, these phases also apply. So being ignorant of the services that you receive or paying attention to them, taking responsibility for them, etc. So the second point is about this piece of taking care of. And the third one, which was the one we did earlier this year, is about the actual practical care work, which is often unpaid. So this is washing, feeding, clothing, cleaning, including domestic work in the broader definition of unpaid care work. It's the physical work of caring, which is routine and is often experienced as drudgery. At the same time, as we reflected last time, this care work, for those who are often engaged in care, the value of that care work is often quite correctly perceived as quite valuable. All of us, we would not be alive today if somebody had not cared for us at some point and provided this kind of care to us. So the care work is difficult work, but it sustains life. So that's a quote from Tronto, which I don't have a bumper sticker, but if I had a bumper sticker, I would put that as a bumper sticker. So then today we're talking about receiving care. So for all of these, we've spoken about what does this mean for men's engagement in an ethic of care? And today we're going to talk about especially men receiving care. We can talk about men giving care and those who are receiving the care from men, but I wanted to zoom into this quite contentious topic of thinking about men receiving care. I just also want to, before I go to the panel, just to mention the words underneath the circle. So attentiveness, responsibility, competence, and responsiveness are the moral elements or the ethical elements that Tronto had identified in association with each of these phases. So in other words, if we look at giving care, if you're not providing care competently, it is a moral failure. It's not a good thing, to use quite a simple framing. And that also then highlights the point that this care is not only an individual activity between two people, but it depends on a care system. So those who are providing care actually have the resources, the training, the qualification, the budget, the resources, the time, the leisure, the energy to be able to provide that care. One link that's quite clear between the idea of competence being a moral element of caregiving is how men are often portrayed in sitcoms, romantic comedies, media, advertisements. A few years ago, a Huggies advertisement as incompetent buffoons who do not actually know what caregiving is. And we find it easy to laugh at men in media who are incompetent at caregiving. So 3 men and a baby, etc., etc. And that's interesting, is that you can see there the moral boundary that actually separates men from caregiving. And actually what it does is, besides separating men from caregiving, it actually positions us as the ones who should be taking care of profit and politics and power. So let me go to the panel, and we can raise a hand or I can just direct. But the question is, in your work, maybe for each panelist to just say a little bit about which project or program or aspect of your work. It doesn't have to be your professional work, like Thomas has pointed out. It could be your work with your child at the moment. But where in your work do you see the marginalization and the disempowerment of those who give and receive care? Is there anyone who wants to go first?
Yeah, of course, no worries at all. And I think that this is a very, very important question. Obviously, the work we do at Promundo, there's much that we find from the images studies that, large percentages of women and men think that women are better natural caregivers, which is, I think, very much in line with Tronto's theory that care is associated with like a naturalness, which is also situated in this like social, cultural, gender role. But I think that what would be really interesting to highlight here is when we're thinking about men receiving care, I want to talk about something we did for our State of the World Fathers in 2019. So we were looking at men and equitable caregiving, and one of our co-authors is participating as well. Nikki is there as well. So one of the most interesting statistics for me that jumped out was that across 7 middle and high income countries, 85% of the men said they want to be involved caregivers, right? And I think that, certainly there will definitely be social desirability bias, there was self-reporting, but 85% across 7 countries is very, very high. But in respect to receiving care, one of the areas that they often reported was that when they wanted to take paternity leave to bond with their newborn child, managers were the most restrictive factor in a workplace for them across the 7 countries. So I think that there's this tension between, right, sort of giving care and then, because receiving care in an interpersonal relationship with your coworker would mean something along the lines of having a manager understand and, and provide that kind of flexibility, for instance. So I think it's really important to also recognize, we didn't ask the manager's gender, but we do know from research, right, like who sort of tends to hold a lot of the leadership positions, they tend to be men. It's very interesting to think about how men disempower other men in the way in which and how that would mean, how that it translates into receiving care. So I think that was one thing I really wanted to talk about. And the other thing I want to talk about, which I'll talk about throughout the talk, is another work that we're doing now, and it's going to get released in about a month. I think it's very interesting to talk about receiving care from others, but we are now beginning to look at receiving care by oneself for oneself, right? And I think that's, I will discuss how that's impacting men in positive ways, but also that like this idea of self-care. So we have this study where we're saying men and women are saying that caring for everyone is gendered, but what about caring for oneself? Is that gendered too? And we do find that it is gendered, but men are more willing to say that it's okay for me to take care of myself. The thing about that is that one of the big things we find about taking care of oneself is that when they're able to take care of themselves, they're actually able to then give care to their family members in a much more profound and impactful way. So I'll stop there, but I think that, one of the things I want to talk about is receiving care, but also let's think about receiving care for oneself.
Thanks so much, Taveeshi. Asanda or Thomas, would either of you like to add?
Yeah, I'm happy to go. I'm just reflecting on what you're saying about men being able to take better care of themselves when they take care of themselves. That makes sense. Yeah. And I'm just thinking also about how for men, a lot of the time, the invisible unpaid care work that is done by women on behalf of men is often not recognized. And so there's a sense in which men separate care work. So they'll understand that, mental health breaks, they'll understand that taking care of themselves sort of physically and their health is important, but they won't recognize the things that others, and in particular the women in their lives, do in order to facilitate a lot of that. Because often for men to be able to go for a run, for men to be able to take that break, it means somebody else often is looking after the kids, and somebody else is often, giving the space that's needed for that mental health break. And I think this is where the inequality comes in, that it's almost expected for women to step in a way that allows men to be able to take care of themselves. And then when it's time for women to take care of themselves and take that time, there isn't necessarily the same kind of reciprocity, and there isn't necessarily the same kind of understanding. And often as women, we talk about this as being selfish, and because we talk about it as being selfish, it then sort of gets brought down to almost like a personality trait, whereas actually what it is that it's institutional, and that it's about socialization. Because as women, we're not socialized to be people who can take a break from being a mother, or take a break from all the other hundreds of responsibilities that we have. And I think that we need to think about it more from a socialization perspective of how do we get boys to recognize the care work that their parents do for them, that their siblings do for them, who are more often than not female siblings. And then translated beyond that, how do we then get them to understand that they need to start reciprocating, that it's not good enough to just be grateful to be taken care of, but that the same person who's taking care of you also needs the same space, and sometimes even more space, to be able to look after themselves. Because I know often when women want to take a break, there is a sense in which society looks at them as if they want to abdicate their duties as mothers, or their duties as care workers. And often this comes up, for example, when a woman decides to take a break to go study abroad for a year and leave the kids with the husband, or even basic things. Like I know often when I travel, there's a lot of people who ask me, also, who's going to take care of the kids? And I'm always like, I happen to be in a 2-person household. And so my husband, the other parent, is going to be taking care of the kids. And so there's a sense in which we almost need to keep articulating that the care work that's being done, whether it's being done by men and women, and also that we need to interrogate the socialization in particular of boys, so that they recognize the invisible care work, and also recognize that there's a lot of reciprocity that's needed. Because you often talk about the need for care work, but you don't necessarily talk about the care that's required for those who for the care for carers essentially, which is quite critical. I mean, I think just to add to that quickly, is we at Oxfam South Africa, we did research last year looking at who cares for carers, so looking at who cares for healthcare workers and what care they receive, because they spend a lot of the time giving care. And so there's a lot of sensitization that's required society-wide about, just because I am giving care, it doesn't mean that I myself don't need care. And just because I have capacity to give care, it doesn't mean that, you know, I don't require or need care for myself in order to be able to, you know, give more care. And often, you know, it's only sort of recently that people have started saying things like, you know, as mothers, you have to put the oxygen mask on yourself first, and then you can, you know, help others as you would in a plain type of situation. And I quite like that metaphor, because it emphasizes the idea that, you know, you can't care for others if you yourself have not been taken care of. Thank you.
Thanks, Asanda. We'll get back into a panel conversation later on. So, you know, I think if we can maybe, you know, if anyone wants to come back and reflect on any of the comments now, please note them, and then we'll speak about them again. The 2 points that you reminded me of, Asanda, were that I've recently heard about the fact that the practice of physicians in training in hospitals in residency, the idea that they have to do 30-hour shifts, is purely a tradition. It's actually so counter the evidence that physicians actually have a much higher rate of traffic accidents, and ironically, you know, sadly and tragically, end up in the same emergency rooms that they had just left because of a lack of sleep. And that this is purely maintained as a tradition. There's no evidence, you know, countries like New Zealand or other countries where physicians in residency actually have more humane shifts, like 10 hours or 12 hours or even 16 hours, have a much better rate of both patients' outcomes and the outcomes of the caregivers. And I think that the other point that you raised, Asanda, just to reflect, I actually did an interview with a family this week, and the mother said, you know, they had gone for a picnic, just her and her partner, and the child had gone to the grandparents, and she had used the word saying, just to be out of mom mode. I just want to switch out of mom mode. And it was for me, a very nice reflection of exactly what you're talking about. Thomas, is there something that you'd like to add at this point?
Yes, please. Thank you. Yeah, I think the pandemic definitely has created a lot of disempowerment, especially as we saw in the previous slide, that caregiving is so lowly valued in society. I think the value is even lower now, especially in not maybe in Sweden, but in the countries with planned work at least, because we know from I think Oxfam statistics and others that there's a big rollback now in the situation in many countries where there's not so much formal jobs as in a country like Sweden, for example. But also here, there's been a pandemic support to businesses, and there was just a recent thing here that a private nursing company, where the manager, who is a man, of course, earns in a year the life salary of a woman who's doing the nursing. And there was a big scandal of this support from the government to give them better resources to especially care for the elderly in the pandemic. They didn't employ more nurses, but they gave more bonuses to the managers. So I think that's kind of a situation as well, that if you look at it from a gender perspective, men in the power positions get the salaries, and women in the caring positions don't. And also, there was a recent study that a lot of women who do the care, they don't work full time, because then they cannot, reflecting on what you said with the working 30 hours. They need to rest, because the work with doing the caregiving is so tough, so they need to rest. So instead of trying to get better work conditions and more colleagues, they work part-time to be able to rest, to do the work in and less hours. And the men on top, I don't think they need to do that. So I think that's just a reflection on these
Right.
issues. And then what Asanda said, I think men, they never feel a bad conscience about not being with their kids. If they go for a run, they just ask, I go for a run, and then they do it. But I think women always feel bad when they don't care for their children. But I think that's a very big difference between the two genders. That men just don't even think about these issues, but women always have a bad consciousness about not being good enough parents. But I don't think men do.
Yeah. Thanks, Thomas. And I think we'll get back to this, and I've got quite a deliberate question about this apparent, basically the zero-sum question. So, is it just challenging or thinking a little bit about the kind of, men receiving care versus men giving care, and just trying to figure out politically, how do we place that if we want to be pro-feminist or feminist in our approach. So we've got a particular piece where we want to talk about men's vulnerabilities, we'll get to that in a moment. So thank you so much, everyone. I think, just so if we're talking about that point about cultivating a feminist ethic of care among men, as we've spoken about in the previous seminars, it seems to be that we want to, in the terms of the first two phases, deepen men's engagement to be able to pay more attention or at least notice the care that's happening, that needs to happen, so caring about something, and then also to increase taking care of. We spoke a lot about the financial support of children, and especially the controversy around maintenance and child custody and child support if parents are separated, as a necessary kind of pain point to talk about in terms of the taking care of piece. So we hope that men would, and myself included, would increasingly notice and pay attention and care about and take care of in terms of the resources. But then also we want to see an expansion in the range of men's engagement. So in addition to deepening the caring about and the taking care of, we also want to see a greater uptake in the physical work, the practical work of giving care, where you are actually doing the routine dressing, feeding, washing, cleaning, etc. And in that session, we spoke a little bit about the fact that men often, and I think Taveeshi in some of the images findings and the earlier work, the Men Who Care survey and other research around the world, we've seen that the evidence is quite clear that fathers or men in care of children tend to gravitate towards playing with children as opposed to the more routine or laborious work like washing or feeding or putting to sleep or dealing with recurring behavior or discipline issues. So that's I do believe, and I think my reading of the literature on this is that playing with a child is a form of caregiving. I think in terms of child development, it's really important that fathers do play with children, but I think it's a limited perspective. I think that there's more to caregiving than only playing with a child. And we spent a little bit of attention that on in the previous one. So then today, of course, we're talking a little bit more about expanding men's engagement in care to actually receiving care. So when we speak about receiving care, a key issue that emerges is this point about vulnerability. And I think, in this context, within a pro-feminist and a feminist conversation, it feels almost counterintuitive to talk about men's vulnerabilities, because I think it is true that men's vulnerabilities receive a lot of care already, but then in other contexts, it's not. Men's vulnerabilities are not addressed sufficiently. When we speak about the receiving care phase, there is the point about responsiveness to care. So, and that is related to how competently care is given. And responsiveness, if you remember from the earlier slide, is what Tronto had identified as the kind of moral element of receiving care. And here it actually means not recognizing the care as in the first phase, but actually responding to the care. In other words, if you are hungry and you are fed, then your hunger is satisfied. If you are tired and you have the opportunity to sleep, then you are rested. So it's actually responding, and I think in a recovery from mental health issues or trauma, if you have received adequate psychosocial support, your mental health outcomes improve. So it's actually the just seeing that the care has been successful is what we are talking about here. So I think that's where I'd want to also again throw it back to all of you, or pass it back to all of you. After this round, I'll double click or zoom into a conversation I had with one of my respondents in my study. But before we do that, I wanted to hear from you if we are distinguishing between actual response to care and to thinking about men's vulnerabilities. If there's any reflections that any of you have on that particular point. Thomas?
I can start, yes.
Mm-hmm.
Yeah, I've been working with, you mentioned the work with climate change and masculinity. So this spring, me and a colleague from the Men for Gender Equality had a virtual study circle on men in the climate crisis. And we asked the participants where did they get the information about this? And one of them said that he was given it as a Christmas gift from his female partner. So I think that's kind of even, and it was kind of even though we talked about on a structural level about climate change, we tried to put ourselves in the what we call the small room, the little room, where we try to talk about feelings and ourselves. And I think it was kind of a shock for some of the participants that we were not just talking about statistics and facts, but try to dig deep into ourselves. So at the end, after these 8 meetings we had, I think a lot of the participants realized that being there with other men in a separatist room was about them showing them their vulnerability to and reaction to the climate crisis and how that affects them and their own lives, kind of. So that was kind of, we did kind of receive care as a group of men, which was really, really nice. But I think it was kind of a shock for some of them that this was what these sessions was all about. So I think for men, we are kind of bad at working with emotional labor with ourselves. So even understanding that I have an emotional need as a man would be tricky for, I think, most of us. And then we need to do a journey of finding it and talking to ourselves, as someone said before as well. So just to get men and boys to get going on these reflections, I think is an important first step, which is not always easy to get into.
Thanks, Thomas. Taveeshi or Asanda?
I think I think that there's the nuance between responding and receiving is very, very interesting. I think that I think there's something very also important about, and I know that you're going to talk about this, Wessel, later on as well in the talk, but I think there's something important about finding ways to help men's vulnerability kind of with respect to care, find the space where they can actually do it, knowing the kind of masculine norms that exist and the kind of constraints that they experience in order for them to be vulnerable, right? So I think that, for example, when you're talking about competence and how it's linked to receiving or giving care, we found that in our research as well, right? That men believe they're very competent in caregiving. I mean, we had like 92% of men in the US say, I'm highly competent in taking care of my child. And we had like 76% in Brazil and so on and so forth, right? But when then it came to asking them with respect to their spouse or partner, how competent do they feel across the board. They all felt, men sort of, felt that they're less competent at caregiving than their spouse or partner. And it's very interesting because
was this in images, Taveeshi?
no, this was the actually State of the World Fathers, the Helping Dads Care work that we did.
Oh, right, okay.
And so, I think that that gap in some way makes you think about how can they're competent. Obviously, they're doing things like playing. We know that from the images work. They're not actually doing some of the work that requires, a lot of the mental load as well. But how do we help men sort of shatter this myth of incompetent caregivers? Because I think it is certainly in the ethics of care theory too. It is certainly a step by step kind of process, right? In some ways, or at least they're certainly interlinked. And so like neurobiological research shows that when you have men take care of their children, and particularly their babies, like they have oxytocin, which gets released in their brains, right? And so I think that there is something interesting about, and they don't talk about it in an ethics of research frame, ethics of care kind of work, but I think there is something for us to think about around how does having men feel like they're competent, but then actually having the hormonal change taking place in their brain make them feel like they're actually connecting to their child. Yeah.
Sorry, Taveeshi. I just saw that Liz Darknell. I don't know if Liz is left. I still wanted Liz to also join the conversation. I think she's just stepped off. Sorry to interrupt you. She said she's a great panel, so she has to leave. So Liz is the director of SVRI. So yeah, so I thought she's going to maybe have a contribution. So sorry to interrupt, but you were saying.
No, I just think that there is something to think about when we're thinking about how do we make men, ultimately we're trying to make men better caregivers, right? Men who are giving care better. That's kind of the bottom line that we're trying to get to. And I think the receiving care space is very contentious in some ways.
Yeah,
and
exactly.
You paid attention to that as well. We will always get this space to say, there'll always be a pushback saying, do men really need care? Do they not get care enough? Right? But
exactly.
I think that the recognition that when men are given the care that a different kind of care, there are certain kinds of care that they're given, they will be better they will be better at giving care. And so I think that this is so I think this is really interesting to think about, like, what kind of care are they receiving in order for them to be better at giving care, and in order for that vulnerability to have space to thrive.
Thank you so much, Taveeshi. Asanda, did you want to come in?
Yeah, I wanted to add, I think, to what you're saying. I think it's very important that we do have to figure out ways to sort of debunk this myth of men as incompetent carers, because I think it does sort of lead to men kind of feeling a little bit unsure when they do have to do particularly solo care. I'm just looking at Nikki's comment, for example, around this, and I know that I know with my own husband, for example, I think I've shared this example before, that we had a midwife-led pregnancy, and the midwife, one of the amazing things that she did was to suggest that my husband does the washing of the child when she was a baby, over and above, taking paternity care. And I think that I really had an impact on the relationship that he was able to have with both of my daughters, because he's been engaging with them and caring for them since they were babies, beyond exactly as you've just said, the playing. And I think that, we need to figure out ways to make men do real parenting, so that it's also not this thing of I'm babysitting when you're talking about, your own kids, that you're just being actually a parent. And I think that for me, what's interesting in terms of men receiving care is that, as much as I've said men receive a lot of care, they also are not so great at receiving care, particularly when it comes to health. And I think that, statistics around mental health, statistics around depression, statistics around suicide show that men really struggle to ask for care when it comes to mental health. Men struggle to talk about, the burdens that they face and how those burdens affect them. And I would imagine in a period like COVID-19, where, you have increasing unemployment, men who were able to provide for their families before are suddenly rendered unemployed and are suddenly at times rendered to be an unemployed household or having to rely on their wives to become the main breadwinner. And that does change, the dynamics, and that does change the way in which men perceive themselves, which kind of also goes back to us needing to debunk the ways in which men see themselves as all or nothing. And so I'm a provider or nothing. I have money and I'm able to take care of my family or nothing. And there's a sense in which everybody is clear that, one can be a mother even if they're unemployed, even if they, don't have a penny to their name. But there isn't the same sense with men. And as a result, a lot of men, when they don't have money, then don't see themselves as being able to participate in actual parenting, or besides even just parenting, but just being there for their child physically and what that means. And I think, it's good that we're having these conversations about the receiving and the giving, because I think there's nuances within both that need to be explored. And just to last point, I remember I once attended a gender reconciliation workshop, and what was fascinating for me was how much, because societally we are encouraged as women to speak out, we're encouraged as women to talk about, what's really sitting with us, to see and to hear men being vulnerable about the things that happened to them and how those have a direct link and a direct connection to the violence that they then themselves perpetuated, and their own relationship with violence and their own relationship with the people in their lives was really heartbreaking for me, because it just brought home the idea that as we engage with GBV, as we call for men to stop violating women, we also need to start looking into what are the underlying factors behind the violence, and how does, what impact does the socio-economic status of a man in particular have on their propensity or potential for violence, and how do we engage in conversations that help men to see themselves as fully capable of humanity, with or without money.
Thanks, Asanda. And I'll, Nikki, I think your comments are really valuable, and I think, I'm going to share just a few quotes from some of my research, but in the next round of reflection, when we talk about examples, Tami, if you could maybe activate Nikki's microphone. So Nikki, you're welcome to join us in the conversation in the next round. Asanda, I just wanted to also reflect a little bit about what you were saying, and I think this is one of the places where we see the kind of moral or the kind of foundations of the separation become quite clearly embedded, or they become quite visible if we talk about fathers and money. But whereas on the one hand, like you say, we had done some research in a township outside of Cape Town in Soweto in 2013, 2014, with a group of young fathers who are biological fathers, but they self-identified as absent emotionally and physically. So they were separated from their biological children and they were not involved. And a major reason, one of the big reasons why they had said that they are not in touch with their children is because they are unemployed and they do not have an income. So they feel that they are not able to be a father because they cannot fulfill the provider role. Then conversely, or parallel to that, where you do have a father who is employed, the provider role is also used to avoid care work. So I am earning an income, therefore I don't need to spend time caring for the child. So it's this weird paradox, which actually shows how the boundary is in place, where as a father, I don't have any money, so I can't be a father, or I have money, therefore I don't need to be a father. Or I don't need to care. So it's the argument works both ways, whether you have money or not. And that, I think that quite nicely points out the challenge that lies ahead of us. So just to share a few quotes from, and I think this is actually reflects a little bit what you were saying in your first contribution, Asanda, the difference in the types of care that men receive. So I asked a relatively young father, who cares for you? And the father responded saying that it's a good question. I think my partner would say she cares for me, but there's probably no one who cares for me. Really. I mean, obviously not in terms of not in a bad way. And then he said, like I talk to my mom. We can talk for hours. She is a social worker, so she is kind of like a shrink as well for me, where we can talk about things as well. So when I'd asked this question, who cares for you? He had interpreted that as quite a personal, emotional kind of support that he needed. And then he went on to say that it's quite different with your spouse, where you are partners, you guys love each other, but there's obviously, so you kind of I don't know, it's like equals, and you can't really care for each other in the same way that your parents would say care for you. This is an interesting distinction. And then he ended by saying that my partner is doing so much, she also does stuff around the house and the garden. Sometimes by the evening, she's kind of quite finished. So what I'm seeing are two kinds of care. The one is a very personal, emotional, direct support by his mother as a social worker, or in his experience as like a shrink. But then he also notices his partner doing all of this domestic work, which he actually doesn't really recognize as care for him. He just notices that she does all of this kind of work. So just on that separation between kind of men's awareness of domestic work as care and the kind of personal need of men for kind of a direct support. Any inputs? And Nikki, I don't know if you've got any experiences to share from your family or from your insights. Nikki, do you want to come in?
Hi.
Hi.
Such an interesting discussion as usual, and I think it's a really fascinating topic in terms of men caring for themselves as well as caring for others. But I was thinking about that example of men spending time with their children and how much that gives back to them in terms of joy. That's been talked about a lot, but it's been very interesting to watch my daughter and my son-in-law with their little ones. So my daughter was doing a lot more caring. And once our grandson started to kind of speak, he was really anti-daddy. He just did not want to be with his father at all, until the point where his father started spending more time with him. So but before that, it was mum, then me. Dad was very far down the hierarchy. And almost instantly, when my son-in-law was spending more time, that changed. And I think he felt quite nervous about it. He knew how to play with him. He's brilliant with him. But he hadn't had the kind of practice with him as a small baby that my daughter had had. So I'm thinking the competency thing is really interesting, because what's the thing they say? 10,000 hours you need in order to be good at something. I think that's mainly in terms of sport, but it's also good in terms of looking after babies and children, that you need to put the time in order to get back that competency, but also those rewards. And often you don't. And I think your case example now was really interesting, that not in terms of competency, but in terms of perception, that he didn't see that all the things that his partner were doing, that caring for the household, were also caring for him, the man that you interviewed. So yeah.
Thanks, Nikki.
I'll stop, but I'm sure there's more I can chip in later on.
Sure.
Thanks.
I think just as you're saying, the at least in attachment theory, it's really clear that attachment is related to caregiving. So children attach to those who give them care, and there is a quantitative element there, that the more time you spend in caregiving tasks, the more a child's attachment and bonding actually are embedded or grounded in the relationship. Any other reflections? Thomas, go ahead, please.
Thanks. I hope that someone will do a study eventually on the pandemic and working from home. At least a lot of middle class people who have office jobs have been working from home now for over a year, and that means probably that the children have been at home as well. So how has that affected the relationship between fathers and children? Because as Nikki has said, women, mothers and other women are the primary caregivers, and then men come on third or fourth place. So I wonder if that has been affected by the working from home issue. At least in Sweden, a lot of fathers do parental leave, as I do now, but then during the last year, their female partners have been at home. So I think it's also what we see so clearly is that men need to spend time alone with their children to build this bond with them. And has that been affected by the pandemic? I think that would be an interesting question to follow up on when eventually the pandemic is not over, maybe, but at least phased out a bit. So, yeah.
Taveeshi, I think you've got some findings on that, right, from the How I Care report.
Thank you.
Yeah, well, I was going to actually, first I wanted to talk a little bit about something that you pointed out. We asked men as well, how do you know somebody cares about you? And exactly what you found. They immediately hone in to the emotional care. And so I have a quote that I would love to read. It's a Black man in his late 20s who said, and we're talking about it in terms of friendships. I am Carol Gilligan's student, so we do a lot of male friendships kind of work that's very close to me. So the quote from him is, "How do they show they care for me? Lately, we've been in a habit of telling each other, 'I love you.' Just like we didn't do it as often before, but now it's starting to be a regular thing. And that's a big way. Like, I love you. I appreciate you. Thank you for doing this for me." We're trying to get it like that. And so I love this quote. And I found it incredibly important because, we're talking, care is between interpersonal relationships, right? I think and so we're talking about spouse, partner, mother, son, friends. But we're also talking about care as a moment where we're asking people to be vulnerable, right? And so what I liked about this quote is that this man is saying it's not just about individual level of vulnerability, but that there should be like a collective sense of vulnerability that lets him feel like he's being cared for by his friends. His friends have to be equally vulnerable to say, "I love you," in order for him to feel cared for. And I found that incredibly profound and interesting. So just to reflect on your case, Wessel, that, when we're talking about care, everybody, men, women, they immediately go to a sense of like, sort of this like emotional, cushiony, comforting kind of support. And that's what care means to them. And so then it's about what kind of care are men then giving back? Because again, it's all kind of connected. So if men are receiving this kind of care, then are they able to give back this kind of care too, is the question, and the research needs to be done on that in some ways. So yeah.
Great, thank you so much. Asanda, did you want to come in, or should I go on?
No, you can go on.
Okay, so I think I think we're starting to see the parameters of this conversation in terms of the kind of ethics of the different kind of care that men feel they're receiving, and also the I guess the political challenge, which we'll return to again, of kind of making sure that we, within a patriarchal world, how do we talk about men's vulnerabilities? I think that's a key question for us to speak about. So just in terms of that point, this book came out in 2019 by Professor Bob Pease from the University of Tasmania, where he said that if we only focus on men's power, we will be unable to understand how masculinity also contributes to men's pain. And so please don't see this quote as a reflection of the book. The book is very much a powerful literature survey of most recent research on kind of progressive work to really face patriarchy. I mean, he's quite explicit in the book that, you know, public health approaches have sometimes depoliticized some of the work, and he's calling for a kind of a repoliticization of the work. So, and particularly, I think aligned with Toronto, politicizing the power disparities between men and women. So I think some of Michael Flood and Alan Gregg's work in the symposium has also reflected that conversation, that, you know, if, just to think about being really clear about laws written by men, you know, don't and about men for men don't necessarily speak to all genders. So anyway, so there's the point is the book is very aptly titled "Facing Patriarchy," but he does raise this question about how do we think about men's vulnerabilities. So this is just a screen grab from the Global Health 50/50 mortality data on COVID. So we've seen that for every 10 women, there are only 8 male tests. There's an equivalent number of cases, but there's an increased hospitalization, increased ICU, and increased mortality, increased deaths. And then again, a lower rate of vaccinations. This is a really valuable resource, the Global Health 50/50 COVID, I think it's called the Sex and Gender Project, that track the mortality and the morbidity on the pandemic and how it splits. Professor Mona Cornell at the University of Cape Town has also been publishing about this and writing about, thinking about men, and particularly heterosexual men, in the context of the HIV pandemic preceding COVID. So related to HIV and TB mortality, we see the same, that while more women in sub-Saharan Africa are living with HIV, more men are dying of HIV-related illnesses. And it's connected to treatment adherence, it's connected to early testing, it's connected to actually the rate of access that men have to health facilities or not. You know, some evidence points towards the masculinities involved, so kind of the whole stereotype of being strong and macho, not needing to go to healthcare. But some of it is actually counter to that, and it's very practical about actual convenience, and being linked to more a connection of being the provider, being in the production space, and actually having the ability to go to a health facility if you are working. So I'm not an expert in that field, but I think if we're talking about men's vulnerabilities, the health disparities in terms of mortality in some illness contexts is quite clear. You know, the one example that pops up is we've in the last decade or so, we've often heard about male-friendly public health facilities, and certainly in South Africa, I don't think health facilities are necessarily female-friendly either. So it's more about being gender transformative or gender specific, but also being able to think about how do we actually connect to men's health vulnerabilities in particular. So I referenced the broader work of Alan Gregg, Michael Flood, Bob Pease earlier. I should also mention this piece, which is a triangle developed by Michael Messner, which in the field of masculinities as a subfield of women, gender, and queer studies positions the terrain of politicizing masculinities, or working with masculinities for a political aim, as a combination of thinking about the costs of masculinity, about inequalities among men, so some men have got more power than other men, and then also thinking about the institutionalized privileges of men. And I think this is a really, you know, what this does is, and the organization, some of you might know, members of Men Engage in Europe, masculinities in Switzerland, manner.ch, our friend and colleague Marcus Thunert worked on this, where he actually calls it the triple advocacy triangle, where he added a layer to that of thinking about the costs of masculinity being a advocacy space for advocating around men's vulnerabilities, but it's politically positioned as a component in a broader alliance with a gender justice movement for all genders and a broader alliance with the feminist and women's rights movement. So the point being that the work to advocate for countering men's vulnerabilities is positioned within a broader political agenda. It doesn't become its own agenda that's isolated from the broader human rights and women's rights and feminist movement. So I think I found this quite useful because it can give us potential entry point to not have men's rights become consolidated. So that then is the question, and this is the last panel reflection. I think we've done really well on our time, but we'll also open up for some discussion, and I also want to hear from some examples of things that we can do. So after this conversation, we'll also then have another conversation about, well, what are some examples of what we've seen and how can we move beyond that? So, but let's look at this question. So the question to all of you at the moment is, if investment in mitigating men's vulnerabilities could hold benefits for everyone, and I think it could, how do we avoid this investment from consolidating men's patriarchal power? If anybody wants to attempt that answer in a few minutes, not a few hours.
I guess, I just want to reiterate what we have found, right? And so I think for me, the self-care work that I'm talking about is actually a really good example here. So the bottom line is that we find that men who take care of themselves emotionally, so like, things like meditate or find time to, I guess, spend time in nature, et cetera, they're more likely to be happier. They seek out physical help, mental health help. I mean, they kind of they're more satisfied in their relationships and their job, et cetera. But they're also more supportive caregivers, and they're also showing more equitable partnerships at home. So there's clearly a link between emotional self-care and, kind of positive outcomes. So the kind of care we talk about is really important. We're not saying men who go play golf, right, and they kind of leave their wives at home. It's the kind of care that we're talking about. And when I think about the larger goal being to sort of normalize or mainstream care for men, women, people of all gender identities, then I think the first step is to recognize that clearly for us from this study, caring for oneself, so receiving care and giving care are very much connected. And now we want to degender this giving care piece, right? We want to make sure that it's not disproportionately falling on women. Then we need to invest in some kind of care that we know reduces burden on women for care, but also helps men break away from these masculine hegemonic stereotypes. And I think that's the kind of investment that would help us kind of make sure that we dismantle the dichotomies and the barriers in some ways.
Asanda, I saw you nodding there. Do you want to go?
Yeah, I mean, I think what you're saying is very important, and I also wanted to extend it to also say that it goes back to the whole thing around if you want everybody to live better lives, then you have to work on all the isms that are in place, because if men or women are socioeconomically not doing well, then they're not going to treat the people around them well. If Black people are not, are being prejudiced and are not treated in the best way, then they are not going to treat the people around them in good ways. And so there's ways in which all of these oppressions are linked. And as we do the work of trying to unravel one piece, we need to start with that piece, but also keep going and look at all the other pieces. And I think that, when we engage with men, for example, around their mental health and they are in healthier relationships with self, I think we can begin to see less, there's going to be less gender stereotypes around the LGBTQI community, because, to care for yourself, to love oneself in different ways is not going to be seen as something that only specific people do or only specific genders do. And so there's a sense in which, as we do this work, and as you rightfully pointed out, we have to work with both men and women, because I think sometimes, particularly when we have conversations around gender-based violence, when we have conversations around patriarchy, they often are conversations by women talking to other women. And the more we bring men into these conversations, the more we do, serious work with men, and the more men are able to lead these conversations themselves, the less we are going to see of the kind of unwanted burden of care that women are going to be placed in. And the more we encourage men, as caregivers, the less stereotypes and the less sort of ridicule men who are interested in care work jobs or care worker jobs are going to have. And I think that it's really important for us to sort of pull the different threads and exactly as we've, I think, done here, start to unpack what kind of care and what's different, to the spending the whole day playing golf while you leave somebody else to look after your kids, and the emotional care. And also, how do we begin the process of engaging men themselves to also be able to understand the different cares that are available, and be able to recognize when care is being done for them. And I mean, I think for me, it's always fascinating to see, just as a random example, when a wealthy man, I mean, we've just had the divorce of Bill Gates, and in South Africa, we have various other cases. So when a wealthy man gets divorced, there's always this argument around, why does she deserve 50%? What did she do? Especially if the woman wasn't working or isn't seen to have worked, in a capitalist sense, as equally hard as a man. And that is all because, women's work is not valued. And so nobody recognizes that the only reason somebody like Bill Gates is able to be one of the richest men in the world is precisely because there was someone in the background taking care of the children and making sure that he has a family to go back home to. And this is the work that's required, I think, to sort of make this invisible care work a lot more visible. And I mean, it sounds like a sort of a pithy example, but I think the comments and the engagement around, the equal distribution of wealth in divorces always fascinates me, because there's always these questions of, what did these women do in their marriages that makes them deserving of so much money? Yeah.
Thanks, Asanda. Anyone else wants to come in?
I think the question, is rather how to get more men engaged at all, because so I gave my example of the course we did on climate change. It was, I don't know how many of the men actually found it themselves. So I think still there's a very big gap in emotional labor in relationships and in society, where men are very far away from emotions generally, and are more on the triangle on the institutional level. So I think rather to see how we can get men engaged in everything that is care for anyone, kind of. So I think this. Of course, we have to be aware of the risk that this could consolidate the patriarchal power of men, and I think Bob Peace really puts it out well in his book. But I think rather to see how can we get more men to get into this, because of all the vulnerabilities and the situation for men that is not healthy for men. And still we are not getting men into more emotional work, kind of. So I think it's a tricky question that we need a few weeks to discuss, I think.
No, sure, absolutely. I think that as you're talking, Thomas, the example that comes to mind is in South Africa, we have an evangelical preacher who was quite popular a few years ago. I think he still is, but he had a huge following, a guy called Angus Buchan. So he's a kind of a white traditional man of the earth a picture that he portrays. There was a movie made about his biography where he had a crop of potatoes, and the book and the movie was called Faith Like Potatoes, and he hosted for a few years. I think they are still going on, but he's He's not as active as he used to be. He would host these massive events where men from around the country would gravitate and go and camp on his farm, and he would have. I think the larger ones were 200,000 or 300,000 men per event that would go through an incredibly cathartic weekend. They were kind of signified by men breaking down and crying and sobbing because he was able to open up a window for them to address their own emotional needs and trauma. I mean, it's, as these events go, it's if you travel in a car for 12 hours and you're camping on a farm and you kind of have this experience, reintegrating that into your life is obviously not as easy as it feels if you're having that event at the weekend. But there's been some publication and writing about this, and the events were called the Mighty Men Conferences. So within our context, to think about something being called Mighty Men and encouraging men there was an explicit encouragement to return to their households as the leader of the house, as the man who's the head of the household, and it's your kind of godly position to be able to do that. So that to me is an example of where addressing men's vulnerabilities can go wrong. Where it actually consolidates men's power, and yet it's a chestnut. It's a difficult thing to think about because there might also still be some benefits. So after having gone through such a weekend, a man might be less likely to use violence and might actually be more involved with his children. However, he still fulfills a very consolidated patriarchal position in the house. The one paper about that phenomenon was actually called palatable patriarchy. So thinking about, is this palatable patriarchy? So I don't know where that, in terms of men receiving care and thinking about our need for emotional care, I do think it is really important that psychosocial support, mental health outcomes are supported. But clearly the context and the kind of framing of that needs a lot of work as well. I don't know, Nikki, if you wanted to come in there on any of those points. You okay?
Sorry, I couldn't unmute. Yeah, I think those are some really interesting examples. My first reaction to this question is I'm not sure you can.
Sure.
I think it's really difficult. But then I was thinking about the fact that, men are not very good at looking after their health.
Yes.
I think all over the world, men tend to go to doctors less, tend to get their health looked after less. So is that a vulnerability? I'm just thinking about how you define vulnerability, because I saw that scale that you had about if you're being cared for, you're vulnerable. And we're talking about personal examples. I was thinking about my dad who had Parkinson's for many years, and he really didn't want to be looked after by anybody or take any pills, or he found it really, really difficult. But actually, in going through that process over the 12 years before he died, he became a much more approachable person. He really changed from the kind of patriarch of the family to somebody who, because he'd been vulnerable, started noticing the wonderful things in the world, started being able to show affection, So, is it about mitigating men's vulnerabilities? I'm not sure. And I think that there's a real danger with the consolidation of patriarchal power. But if you think about it more in terms of how can men care for others, and that includes caring for themselves, I have quite a lot of question marks about the word self-care anyway, because it feels very individualistic. But if men in caring for others can care for themselves and become more in touch with their emotions like my dad was, then actually I think that can be kind of disassociated from patriarchal power in some way.
Right.
Yeah, thanks, but it's a good question and a really difficult one.
Yeah, thanks, Nikki. So, friends, we're kind of at the end, and we've had I think this was kind of like a focus group discussion, so it's really been valuable, and when we share the link, we'll share the 4 links as a series. So I really also appreciate everybody who's watching this after the fact. But to close today's conversation, if we're thinking about men's reception of care and responsiveness to care and the different types of care, and then positioning this politically and thinking about patriarchy, are there any examples of good practice in policy that come to mind? Doesn't have to be in policy, it could be in programs, or it could be personal. So yeah, anything that you want that jumps out in your mind that you think this is really something that we need to amplify, so we can refer to that as something that we could maybe learn from.
Yeah, I mean, I wanted to, for me, I think one of the things that's been really good to see was government's introduction of paternal care, of paternal leave in South Africa. I know I mean, Thomas, of course, we can't compare to you, but the fact that there is, paternal leave, because I know that in a lot of countries, it doesn't exist at all. And I think also just to appreciate the work that Men Engage, that the Sonke Gender Justice does, and everybody that's working on fatherhood in particular, and engaging men and encouraging men to think about these issues. I think there's some really amazing work that's going on, and I'm not sure sometimes how or why that work isn't sort of amplified in the same ways that other kind of work is, and that's always a question that sits with me, like why doesn't that work get or receive as much attention? But I think for me also, it's just a matter of thinking through, sometimes it's great policy, but how is that policy implemented? Like Taveeshi said, it's managers who are looking badly at men asking for paternity leave, who are also men. And so even if the policy is there, how is one then received when they do try to engage in the policy? And also, I think just in terms of society in general, there's a sense in which men who care and men who are involved in care work are sort of almost shunned in a way by society. And there's always these sort of weird and wonderful comments that one gets, particularly when you practice equality in marriage. And those are some of the things that we sort of need to look at, because even as actual men, living men are shifting in terms of their perspectives, society's responses to them are not necessarily shifting. So how do we begin the work of shifting society's thinking in order to match their lived experiences and the actual work that men are increasingly doing? I mean, even as we recognize, of course, that women are still doing a bigger bulk of unpaid care work, particularly in the home. And I think also just, to highlight that it becomes important to figure out how do we get men to receive care, particularly in the health sector, when we consider what has been said already, that men who receive care become better caregivers. And yeah, I think just a last thing is just to also think through who supports caregivers, and I think caregivers in general, because I know a lot of people who go through a lot of stress because they have to give care to sick relatives, they have to give care to all kinds of people, but there doesn't seem to be enough support for those who are in almost chronic caregiving roles. Yeah. Thank you.
Thanks, Asanda. Taveeshi, Thomas?
I can, in Sweden we have the municipalities are arranging these open creches for people on parental leave. So I went there yesterday, so it was the day of the open creche. So there was a space where about 15 fathers and 15 children of around 1 year of age. So I think that's a good practice in policy, that you go there, you see other parents, you learn from them. I don't think you do it. You do it just intentionally, or not unintentionally. I'm speaking Swedish now with my son, so my English is a bit rusty. So you go there with your children and meet other parents and talk about, and parenting issues. And yesterday it was 15 men there with their children. So I think that's a good practice. That it's a very low the it's very easy to go there. You just go there and there are other parents and children and you play and then you go home. So there's not a big investment for you as a parent to go to these places. And I spoke to the staff, and next week they will have a focus on gender equality because they do fatherhood trainings as well there. So they will start a fatherhood group next week in Arabic, which is one of the minority languages in Sweden. To also target that group of fathers. So I think to just create the space where fathers could meet, I think is important. And then try to get them going there by having some fika, which is the Swedish word for coffee and buns. So I think that's a very concrete way of just to get other fathers to get fathers to meet, and then they eventually start discussing parenting issues.
No, I think that's so talking about cathartic events. I mean, I had the privilege a few years ago with our friend Vidar, Tomas, to go to a Papa Opet, or Papa open kindergarten, or Daddy's open kindergarten, and it was, I mean, I was sobbing just because, and it's such a simple measure. It's a existing kindergarten that just allows parents to join the class for an hour or two in the morning. So it doesn't require any other investment besides a teacher's willingness to have parents in the class for an hour or two. And then to be explicit about saying, okay, one of those days in a month, if Wednesday is always parents' open day, then one of those could be a dad's open day. And it's so powerful to have a group of dads spending an hour with their children in a class with a teacher singing songs or painting or whatever. It's a really, really nice measure. And I know we're talking about receiving care, so that's an example of supporting men's engagement in caregiving, but I experienced that as an opportunity to actually receive care, being actually invited into such a caregiving space. I just also note your kind of running commentary there, and it's good stuff. So keep that coming. Taveeshi, did you want to come in?
Yeah, I mean, I think that the upcoming State of the World Fathers is going to talk about, what does a world with egalitarian, I guess, caregiving in some ways look like. And it's drawing on multiple kind of studies. And Nikki, you can speak better too because you're author there. But one of the things they found, there's a study, not Promundo, but somebody else had done a study across 25 countries, and they kind of interviewed everybody from like people who they put in on a scale of equitable caregiving and equitable couples to like inequitable caregiving and inequitable couples. And I don't want to give away the fruits of the labor before State of the World Fathers is released, but I think what I thought was very interesting is that universally, one of the traits that was common across the equitable couples was that they both partners in the couple shared a commitment to equality, and that they had a strong belief that women and men are equally capable of caregiving. So bringing in back the competence question. And the way it relates to my personal life is that, because I was thinking about, an example of something good practice, and it's not policy, but the pandemic has created a lot of homeschooling situations for, tons and tons of parents. And the way I think the only way it would have worked in my household, for instance, is that my husband takes on much of the class and the coursework during like the classes, sitting in the classes. My daughter's only 5, so he has to sit with her. He has to actually engage with her. And so in some ways, and that has been, something that's really helped. But then I also think about it, in terms of like seeing fathers on the screen, other fathers seeing fathers on the screen. And there's multiple children who are seen with their fathers sitting in this homeschooling environment, very much to what you're saying, Tomas, right? There are like 15 dads there. And so this normalizing, but then also in some ways creating I'm going to use it in a very funny way, but peer pressure for other fathers to step up and be those kind of caregivers, I think it is in some ways good practice, right? Where you're kind of creating this normalized world, but then you're also making other fathers feel like, oh, look, his dad is sitting there, or her dad is sitting there, I should be sitting there too. So I find that very interesting. And I also find it interesting that when you link it to the research, that having these shared beliefs between the couples around equality and competence may be one of the very important driving factors to ensuring that the receiving and the giving are happening in a parallel but similar way.
Thanks a lot, Taveeshi.
Can I just want to add something. Like, you just said something that's actually triggered something I've been thinking about a lot around fatherhood in schools. What would really be interesting for me is to see more of this work also targeted at schools and teachers and people who manage schools, because often the correspondence is directed at women. The expectation on the class WhatsApp groups is that it's going to be women who are the main caregivers and the ones who are running around taking the kids where they need to be. And so there's a sense in which schools almost normalize the absence of fathers and play a very active role in making fathers feel like they shouldn't be involved in any of the stuff. Like, I often find I have to constantly tell my school's WhatsApp group to please add my husband, because apparently most of the men on the group, or most of the parents on the group only have the mother because maybe she's a stay-at-home mom, or she works half day, or whatever it is. And I think it's just so important for schools to be engaged around the importance of presence fathers. So even if it's really just that they are physically there and they know their unique engagement, but it's this thing you were talking about, the peer pressure, that if your husband is the only one that's on the WhatsApp group, then they also start to ask questions. Whereas if everybody's on the WhatsApp group and then there are individual, couple negotiations around who's going to do what, then it's a different thing. And I think for me, it's actually quite scary how schools work very hard to reinforce very patriarchal and very harmful practices in society in ways that are, never questioned. Like, if there's a cake sale, there's an expectation that it's the mother who's going to bring the cake and not the father. And often when it is the father, there are questions again. And these are like, it's the little things, but it's really the things that make a big difference, because they're modeling behavior to children, and they're also affirming very harmful stereotypes about who is and isn't supposed to be engaged in child rearing and parenting in general.
Asanda, what you're saying makes me also think about, the study that I shared about the 25 countries. Another common trait that they had is that the equitable couples were mostly middle income and more. And so the school that my child, for instance, goes to over here is like a private school. It's an international school. It's already sub-selected a group of parents who may probably end up falling, certainly on the middle income spectrum, but also on the equitable couple spectrum. And so I find that so interesting that you're saying something along that, that what can the school do? The school, and my child's school, for instance, is constantly pushing for both parents being part of like WhatsApp groups, or coming in for, sort of the sustainable change kind of, whatever big sales and stuff that they have. But that's not the case in a lot of my acquaintances' children's schools. So I think that kind of variation is certainly present, and I think that where change will come where we discover why that variation exists. So for us as researchers and practitioners and scholars, essentially, we need to understand why that variation exists, and then kind of that, when your next question, Wessel, what needs to change, that's what we will know what needs to change, is when we figure out why it's happening in one and what's not happening in the other, and why is that.
Thanks, Taveeshi.
I think so. Just to add to that, it's what I've found is that because it's obviously something I'm very interested in, and it goes back to what Wessel said at some stage around men either are not present because they don't have money, or have money and therefore feel that they don't need to be present. So in a lot of circumstances, the expression is that, well, I'm bringing in the money, therefore I don't have to take care of these little annoying administrative things. And from there, it just sort of snowballs and becomes normalized in ways that, we don't often challenge enough.
No, exactly. I think that two interesting data points. I think to kind of underpin or reflect what the conversation is where it's going. The first one is co-residence stats between biological fathers and children in South Africa. Is quite interesting to look at if you look at the intersection of income and co-residence. So for all parents in South Africa, we've seen across the last decade or so that co-residence of biological fathers and children is at about 36-37%. So that means that 37% of children in the country live in the same household as their biological father. So that's often been misinterpreted as saying that 2/3 of children don't grow up with a father. It's not true. There are many non-residential fathers who are very involved. There are also social fathers who are not biologically related to a child who are very involved. But the point about the income is that for the country, the average is 37% of children co-reside with their biological father. If you look at employed fathers, 90% of children co-reside with their fathers. So for employed fathers, the co-residence radically goes up. So, South Africa and I think some other industrialized countries there's this a very clear history of migrant labor where families were deliberately separated, and men were, especially black, low-income men, were separated from their families to support the mining complex of the country. So I think we're still seeing the intergenerational effect of that legacy in low-income black households. But if you look at the co-residence, it's for those who are in the middle class, it's actually if a father is employed, the child is likely to live with the father. And then in terms of the ethnic groups or the racialized categories that our statistics entity looks at, the racial categories are actually also really close to each other for the upper income group. So between a black family and a white family in South Africa, if they're in the upper 20% of income, both are actually about 70% likely to co-reside, fathers co-reside with children. So there's a link between class and fatherhood here as well. I think what that highlights is what Toronto is, on that spectrum, that spectrum is an intersectional one, right? So it's not only about gender, but it's actually that the care receiving and the caregiving are also about low-income earning black families who are left to do the care receiving and the caregiving. And that there's an increase in terms of power, and as social power accrues to kind of money and profit, there's actually also a higher likelihood to have the opportunity to engage in caregiving behaviors. So anyway, that's a whole other seminar series on its own to kind of look at the intersections of care. But I think that was the one data point, is this interesting thing about co-residence. The other one is this book that I think, along with Toronto and Gilligan, some of you might know Arlie Hochschild, who wrote the book The Second Shift. So the second shift is a shift that a mother has after she does her paid work. She comes home and she does the second shift of work and cares for the children and cleans the house, etc. And she also looked at this categorization that you were mentioning, Taveeshi, of traditional, transitional, or egalitarian families. And what was really interesting was that she identified the difference between the actions, so the practice of care, and the actual ideology or justification of care. So how couples the difference between what they were doing and what they were saying they believe in. And it was really fascinating, because you would find that in some families, she called it the gender ideology, a couple would, if you look at the time spent on caregiving, a male partner might spend 2 hours, whereas a female partner might spend 4 hours a day or 5 hours a day on domestic work. But the significance for the couple of the men's work is more important. So let me just put that in an example. So my wife would prepare the lunch boxes, or make sure their clothes are put out for school for the next day, and just check that the lights are off in the evening and that the dog's bowl is full of water, for example. I would take out the trash. But we would say to each other, we're an equal couple because I take out the trash. Right? So the significance of men's care work is amplified artificially to have this kind of running ideology that we are an equal couple. Anyway, that's I think from the data that you're talking about in the 25 countries, I'd love to see if there's some comparison between practice and ideology.
You've got Nikki, actually. I think she's posted a couple of really...
Oh, wow. Okay, there we go.
Yeah.
Okay. Great. So there's a great from Cecilia in Brazil and Catherine from the United Kingdom. Wonderful. Thank you, Nikki. So, colleagues, I think, we've come to the end of this session and of this series. I'm going to open it up to panelists for any closing comments. So if you want to say something, please, let's do that. Let's just do a round. Otherwise, we can just close it right here. I'm really, really happy with the rich conversations we've had, and I think this series of seminars, those 4 links, I think are a great resource to share with somebody as a primer for thinking about men and care. And I really hope that the posting of these will get a lot of traction. But I've also just, even though the numbers have been small, I've really appreciated the depth of the conversations we've had over the last 4 sessions, over the last few months. So a big thank you to the Ubuntu Symposium, Bianca, to your support, and Yoni and Laxman. It's fantastic to have done this. And I'm not going to share the numbers that Bianca shared with me before the session, but this has been a massive conference. It is a massive conference, and in our little side breakaway room, I think we've had really valuable conversations. So I'm really appreciative. Let me pass the mic along to the other panelists, and then I think Nikki also organizes to have some final input from you, and then I think we can close the session. So let me pass to Asanda, and then you can pass to the next person.
I'm good, thank you.
Okay, thank you. Taveeshi, any closing comments from you?
Not really, except for we should just always think about the type of care. I think that has been my big takeaway. That when we're talking about men receiving care, we need to talk very clearly about what kind of care should they be receiving. It's not about getting a cold beer from the fridge, right? I think that there's the cute, well, yes, that could also be, but I think in terms of, we're talking about receiving care that in turn makes them better at giving care. I think that's the clarity that we need to ensure our work constantly brings forth. But yeah, it's a great conversation. Thank you.
Thanks, Taveeshi. Oh, Thomas. Hello, bro. Do you want to say something, Thomas? You don't really need to. We can see what's going on there.
I don't know if Bro wants to say anything. He has two nappies. His mother went to pick up her daughter at school, so he's with me now. Do you want to say something, Bro? Sorry, Taveeshi, did you finish? Yes. I just want to say thank you as well. Thanks to everyone, and thanks to Wessel especially for organizing these 4 events. And I think it's a continuous discussion we should continue having as a part of our global community working with care. So I think it would be great, even though the Ubuntu Symposium is ending, to continue these discussions within the men care community as kind of a regular series of discussions, because I think it's extremely valuable to just listen to other countries and situations, and also the personal examples makes it much more lively. So I just want to say thank you all.
Bra, jättebra.
Jättefint. Tack så mycket.
Ja. Hej då. Thank you. Thank you, Thomas. And Nikki, did you want to come in?
Yeah, only to say I agree with you about the depth of the conversation. I've been at all 4 now, and I've listened to a few of them again. And yeah, I love your kind of, your framing of it, Wessel, and I think the conversations have been really rich. I'm actually putting something together for the Ubuntu Symposium on unpaid care, and these 4 will obviously be key to, I think Bianca, you're calling it a knowledge product, but there will be something
nice.
That's one of the contributions that this can make to that. So yeah, I'm
lovely.
working out how to write it up at the moment, but certainly some of this will be really helpful. So yeah, nice to see you all.
Thanks, Nikki, and welcome, Karen. I hope you have an opportunity to watch it online. It's great to have you here. Karen from Mosaic in Cape Town has also been a stalwart activist in the men care movement. So it's great to have you with us, Karen, as well. Okay, colleagues, and I think that's it for now. So let's end there. And I don't want to say take care, but please take care of yourself and take care of others and engage in an ethic of care.
Sorry, thanks everyone. I just wanted to share with you, we have a great session coming up next week with SBRI, and now I've just moved us past it, about a researchers and practitioners dialogue about do programs engaging men to end violence against women work, and so what is the evidence telling us? That will be next Thursday, and in Spanish and English. And then I also was starting to announce that the closing is officially happening on June 22nd. It will be taking place online with a very small hub in Rwanda, and we will be sharing details about the closing soon, as well as registration details. So yes, thank you, Wessel, for organizing this series. Thank you to all the speakers for being with us today. And we look forward to continuing the conversation, as you say, beyond the symposium. So thanks, everyone, and we hope to see you online again soon. Bye.